Welcome to the Victory Education Lounge. I'm your host, Maurice, and today we're diving into an exciting topic: Stem Cell Hope, Transplant Options for Sickle Cell, Part 32. Before we begin, please take a moment to like this video, subscribe to our channel, and leave a comment sharing your thoughts or experiences below. Your engagement helps us reach more people with this vital information. What if we could transform the lives of those living with sickle cell disease, not just manage their symptoms, but potentially cure them? Stem cell transplants may hold the key. Sickle cell disease, a genetic disorder characterized by misshapen red blood cells, causes immense pain and complications for millions worldwide. The traditional approach has been managing the symptoms, but what if we could do more? What if we could offer a cure? Enter the world of stem cell transplants. These transplants, where healthy stem cells are transferred into a patient's body, represent a beacon of hope in the fight against sickle cell disease. The promise they hold is immense, potentially transforming the way we approach this condition. From options like allogeneic hematopoietic stem cell transplant to autologous stem cell transplant, each offers unique advantages and challenges. So, are you ready to explore the potential game-changer in sickle cell disease treatment? Join us as we delve into the different types of stem cell transplants available, their pros and cons, and the hope they bring for those living with sickle cell disease. Before we delve into the world of stem cell transplants, let's first understand what sickle cell disease is. Sickle cell disease, a genetic blood disorder, turns red blood cells into a crescent or sickle shape. This abnormal shape can cause blockages in blood vessels, leading to severe pain and potential organ damage. Normal red blood cells are round and flexible, allowing them to glide smoothly through the body's blood vessels. However, sickle cells are rigid and sticky, often causing them to get stuck and disrupt the flow of blood and oxygen. This disease is inherited, meaning it's passed down from parents to their children through genes. Traditional treatments for sickle cell disease have focused on relieving symptoms, preventing complications, and reducing the frequency of sickle cell crises. These may include medications, blood transfusions, and in some cases, a bone marrow transplant. While traditional treatments focus on managing symptoms, stem cell transplants offer the potential for a cure. Now, let's dive into the types of stem cell transplants available. These medical marvels offer a glimmer of hope to those grappling with sickle cell disease. First up, we have the allogeneic hematopoietic stem cell transplant, often abbreviated as HSCT. This is the most common type of transplant in the field. In this process, the patient receives healthy stem cells from a donor. Imagine it as a fresh start, a new lease on life. The potential for a cure and an improved quality of life are the shining benefits of this procedure. However, every silver lining has a cloud. The challenges include finding a suitable donor, the risk of graft versus host disease, and potential complications from the procedure itself. Next, let's talk about autologous stem cell transplants. Here, the patient's own stem cells are modified to correct the sickle cell gene, then reintroduced into the body. It's like fixing the problem from within. The key advantage: no need for a donor. This significantly reduces the risk of rejection. However, this technique is still in the experimental phase, and the long-term effects are yet to be mapped out. Then we have the haploidentical transplant. This procedure uses stem cells from a half-matched family member. It's like using a spare key when you can't find the original. This method widens the donor pool, but it does carry a higher risk of complications. Moving on to cord blood transplants, an option that uses stem cells harvested from umbilical cord blood. This is especially promising for children. The risk of graft versus host disease is lower, but the trade-off is that it might take longer for the immune system to recover. Lastly, let's look at gene therapy. Although not a transplant in the traditional sense, this technique modifies the patient's own stem cells to produce healthy hemoglobin. It's like reprogramming the system to function correctly. Early results from clinical trials are encouraging, but we're still in the early days of understanding its potential. Each type of transplant comes with its own set of advantages and disadvantages, and the best option varies from patient to patient. It's like choosing a car. What works best for you depends on your specific needs and circumstances. The choice of transplant type should be made in close consultation with healthcare professionals, taking into account various factors such as the patient's age, overall health, and severity of the disease. Remember, stem cell transplants are not a one-size-fits-all solution. They're a beacon of hope, a promising tool in the fight against sickle cell disease. But they're also a complex and serious medical procedure with potential risks and complications. As we continue to explore and understand these options, we move closer to a world where sickle cell disease is a thing of the past. Let's look at some real-world examples of how these transplants have been used in the treatment of sickle cell disease. Our first example hails from the year 2019, at the UCSF Benioff Children's Hospital, Oakland. Here, a team of dedicated doctors successfully treated a teenager suffering from sickle cell disease. The treatment? A haploidentical transplant using stem cells from a half-matched donor. This was a significant breakthrough, opening doors for patients who previously had no options due to a lack of fully matched donors. Next, we turn our attention to the National Institutes of Health. Here, an adult with severe sickle cell disease achieved complete remission after undergoing a stem cell transplant. The source of these life-saving cells? Her sister. This case underscores the immense potential of allogeneic hematopoietic stem cell transplants. Moving on to the city of Boston, home to the renowned Boston Children's Hospital. Researchers here have been pushing the boundaries of what's possible with gene therapy. In an innovative study, they used this technique to treat several sickle cell patients. Let's jet across the Atlantic now to a multi-center study in Europe. Here, researchers were exploring the potential of cord blood transplants in treating children with sickle cell disease. Their findings were encouraging, with a success rate of over 90% in carefully selected patients. Our final stop on this global tour is back at the National Institutes of Health Clinical Center. Here, a novel approach that combines stem cell transplant with immunosuppression has shown promise in adults. This is particularly significant because it offers hope for those with organ damage from sickle cell disease, a group for whom traditional treatments have often fallen short. These examples highlight the potential of stem cell treatments, but it's crucial to understand that they are not without risks. As we've seen, each type of transplant comes with its own set of advantages and drawbacks. It's essential for patients and their healthcare teams to carefully weigh these factors before deciding on a treatment course. The decision to undergo a transplant isn't one to be taken lightly. It should take into account a range of factors from the patient's age and overall health to the severity of their disease. As we continue to explore and refine these treatments, the hope is that more and more people suffering from sickle cell disease will be able to lead healthier, happier lives. Stem cell transplants offer a glimmer of hope in the fight against sickle cell disease. In our journey today, we've revisited the debilitating nature of sickle cell disease and how it morphs healthy, round red blood cells into misshapen crescent forms. We've underscored the fact that, while traditional treatments focus on symptom management, stem cell transplants are a beacon of potential cures. We've delved into the various types of stem cell transplants available today. The allogeneic hematopoietic stem cell transplant, the most common type, uses stem cells from a healthy donor and holds the possibility of a cure. Autologous stem cell transplants, on the other hand, modify the patient's own cells and eliminate the need for a donor. The haploidentical transplant expands the donor pool by using half-matched family members' stem cells, while cord blood transplants, especially promising for children, utilize umbilical cord blood. Lastly, we've shed light on the groundbreaking gene therapy that modifies the patient's stem cells to produce healthy hemoglobin. We've also shared real-world examples that reflect the potential of stem cell treatments, from the successful treatment of a teenager using a half-matched donor to an adult achieving complete remission after a stem cell transplant from her sister. We've seen how gene therapy has allowed some sickle cell patients to remain symptom-free for years, and how cord blood transplants have been effective in treating children with sickle cell disease. Yet it's essential to remember that these treatments are not without risks. The decision to undertake such a transplant should be carefully weighed, considering factors such as age, overall health, and disease severity. It's a conversation that should be had with medical professionals who can provide comprehensive guidance. With ongoing advancements in medical science, the potential of stem cell transplants continues to grow. But as always, any treatment decision should be made with careful consideration and consultation with medical professionals. Before we wrap up, I want to emphasize that the information in this video is for educational and entertainment purposes only. Any health-related decisions should be discussed with a licensed physician who knows your medical history and can provide personalized advice. Thank you for joining us in the Victory Education Lounge. Your support helps us continue providing valuable information about sickle cell disease and potential treatments. Don't forget to like, subscribe, and share your thoughts in the comments. Until next time, this is Maurice wishing you health and hope.